Welcome to a Business Minute with Lily Lopez, presented by the South Florida Hispanic Chamber of Commerce. Today we are at IMC Health Medical Centers with the CEO, Mr. Bill Lamoreaux, directly from Pennsylvania. Originally born and raised, and now he's been here in South Florida for the past 4 years. I'm sure he loves it. So, Bill, welcome, and thank you so much for your time. Tell me, how did you start, when and how did you start in this career?
So, in college, I was a health economics major, and I was always interested in what drove the cost of healthcare and why was it so high. And I got into the HMO business back in the 1980s, believe it or not. And after 30 years of being in the health insurance business, I just never thought that health insurance really addressed the drivers of healthcare cost, and really were making an impact in healthcare quality. And so when I had the opportunity to come here at IMC and get more directly involved in the delivery of care, it was very attractive to me, and it's been really, really rewarding in terms of the direct impact that we've been able to have on people's lives.
Absolutely, and I was able to be here and visit a couple of weeks ago, and I was so impressed with the service, with your staff. This was just amazing. So tell me the challenges that you have, and with IMC now with the pandemic. I saw that it's been amazing, the job that IMC Health Medical Centers has done, and I know that you're starting to open slowly because I know that the people that you serve are eager, right, to come. And I know you have gatherings here, and you used to before, like all the medical centers. So what are the plans and what are the challenges that you face now that things are going back to normal slowly?
Right. So at IMC, we do a thing in healthcare technically called value-based care, population health. And with that as our mission, we've always tried to be proactive in engaging our patients, whether there's a pandemic or no pandemic. And during the pandemic, because we couldn't have people come in, we had to be proactive in doing a bunch of things, like we delivered over 400,000 meals to patients throughout the course of the pandemic.
That coordination must have been difficult, right?
Yeah, we're not a caterer.
Imagine that.
And we're not Uber Eats, but we were delivering over 1,400 meals a day for over a year. We place phone calls to the elderly. We talk to 4,500 elderly patients every week just to try to combat loneliness, make sure that they understood what was going on with the pandemic, how to stay safe. We did a bunch on Facebook Live around health education, activities, and keeping people engaged. And then we did a lot on telehealth. Within a month of the pandemic hitting, we had a telehealth capability. We were doing over 350 visits a day via telehealth in the middle of the pandemic. So
and was that difficult? Like, imagine for the seniors to be able to log on so that you have someone teaching them? How was that possible? How were you able to do that? Because that's very challenging.
Yeah. So if you think about it, the age range of what we call elderly is pretty wide, right? It begins at 60 and goes to 100 plus, right?
Exactly.
And so the 60-year-olds, the 65-year-olds are pretty adept at technology, of course. Right? And so it wasn't much of a challenge there. But the older folks, they had some challenges with it. And we actually had to set up tablets that were pre-programmed. We drop them off at the house the night before the visit, and we'd pick it up after the visit, and then we'd just rotate through to the next day.
So they just have to press a button.
Press a button, all of a sudden your doctor's on the screen for you.
So that must have been a lot of fun for them because it's something new, it's technology.
Yeah, and they were dying to see their doctor, right?
Right, of course.
They trust their doctor. They love their doctor, and we found a way to bring the doctor to them.
Especially for Hispanics, and this is primarily a Hispanic community. In Miami-Dade County, it's like 68% Hispanic. So for you, as someone from Philadelphia, what were your feelings when you got to this market, which I assume is different because Hispanics are all over each other. The families are so worried. So you have, if you have a patient here, you probably get the grandson or the granddaughter calling, and people are all over each other. So how was that experience? Because Hispanics are so one on top of the other, so caring. And I know that because I took care of my father and my mom, and for many years they were ill and they passed away, of course. But I remember I was always, it wasn't enough, right? Everything you do is not enough. You want to do more and more. So how was that? How was that experience?
Well, it's fun. Relationships are obviously very important. And their extended families here are very prevalent. Yes. And in some respects, wanting more is always a challenge because we're trying to figure out what's next, right? like a couple of years ago, we didn't offer things like
Right.
acupuncture, but we do offer acupuncture now.
Oh, acupuncture
right?
too.
We do offer pain management now, and we didn't offer that a few years ago. So we can keep trying to innovate and provide more services. But in other respects, having extended family makes it easier, because if that elderly person was having trouble logging on to telehealth, you could have the son or the grandson,
Exactly.
granddaughter help them log in, and so there were some aspects that were very beneficial in terms of
exactly.
the family and the
Because of
relationships
family.
and the extension of.
Okay.
We'll conduct some events in the community around health education, or at the time of open enrollment, information about health plan availability. We'll invite the health plans in for that. But then we work with other associations like behavioral health organizations.
Okay.
And other specialty practices to educate patients on, the challenges of behavioral health with the elderly, and how families could get involved in supporting the elderly patients. And if we can find somebody that adds value to the patients that we care for, we'll invite them in and figure out ways to collaborate with them.
I got it. And how many centers do you currently have here in Miami-Dade County? And are you in Broward also?
We have 13 centers in total between Broward and Miami-Dade.
And expanding?
By the end of this year, we'll probably be double, if not triple, in size. One of the really exciting things going on with IMC right now is that we're merging with an organization called CareMax.
Okay.
They are equal our size, so we'll have 26 centers just between the two of us.
Okay.
Probably by the end of next month. And then we have aspirations to grow throughout the rest of the state of Florida, and to take this model that's very unique to South Florida nationally.
I know the model. Could you explain a little bit for the viewers? You had mentioned, so how does this model work? Because I know it's different to other healthcare companies. Yes.
So most primary care,
Right.
you get ill, you call up your doctor, you go in, and your doctor treats your illness, prescribes something, and off you go. Our population health model, we surround the patient in services and support.
Okay.
And so minimally, we want our patients to come visit us 4 times a year.
Okay.
If their conditions are significant, we want them to come in much more often than that.
Okay.
We study their chronic conditions, and if they have a chronic condition where the science says that something should be tested on a certain frequency, we will proactively call them and bring them in to get them tested to make sure that their chronic condition is in check. But the other thing that we do is we try to address the social determinants of care. And so if a patient needs a transportation to our office or to a specialist, we will transport them.
Right, I see the buses, yeah.
If a patient needs access to more social service programs, we have access coordinators who help them sign up for those social service programs and extend their benefits. We bring specialists in-house so that they don't have to go to 20 different places to have their care.
It's convenient.
We share our medical record with those specialists, so we have a full picture, holistic picture of what's happening with all of their care.
A holistic approach, yes.
Part of what happens in America is you run to 10 different doctors, and none of them are able to communicate with one, right?
Exactly.
And so we try to be the glue to that communication.
Oh, that's amazing. And then plus then you have a room that's for them to play dominoes or whatever. I know has not been used in the past year, but eventually, right, for them to gather like socially, right?
Yeah, we just opened on a limited basis, but we have these social rooms, and it's about engaging patients in health and wellness, right?
Mental health.
Physical wellness, mental wellness, keeping their minds active, keeping them cognitively up to date, and also physical wellness. We have Zumba classes and other health education classes.
And the acupuncture, which I love.
We now have pain management.
Yeah, pain management. That's great. So that's an added value.
I'm getting older, and I got a lot of creaks, and I'm sure I would like it if I was eligible.
Absolutely. Me too. So, Bill, did I leave anything out that we may want to add for our viewers? Then you want to be highlighted?
Yeah. The one thing that I will tell you is we've talked a lot about the services we provide, the care we provide, and the outcomes that we produce.
Right.
Which I didn't say. We're a 5-star medical group.
That's important. 5-star.
The
Ritz-Carlton.
Yeah, the highest measure that CMS has.
Oh,
right? But that's where I was going with my comment. The thing I'm most proud about at IMC are the people we have.
I know that.
They are all caring. They go out of their way to provide service above and beyond what the patient expects.
I have seen it personally.
And this is a person-to-person service,
yes,
and the people that we have rendering our service matters. And it ranges from the people that work at the front desk to the doctors to the people behind the scenes that generate the data that our clinicians use to invite patients in to get treated. Everybody here cares. They understand the mission, and I'm really proud of the work that they do.
Absolutely. And I see it, and I've seen it today, saw it last time I visited, that everybody is just, they're so welcoming, so professional. I've been very impressed with IMC Health Medical Centers. So thank you, Bill Lamoreaux, the CEO of this beautiful organization composed of wonderful professionals, doctors, and it's just an amazing team of professionals. Thank you for being on A Business Minute with Lily Lopez, and we'll see you.